Welcome back to another episode of HealthCap Weekly Wrap. This week, we're diving into practical tools that make a real difference in resident care. Everything from infection prevention updates to fall risk detection, emergency planning, and a big Medicare policy shift that could change how transitions to skilled care are handled.
Yeah, and we'll wrap things up with a reminder about the words we use, because how we talk about care can be just as important as how we deliver it.
All right, let's jump in.
So, first up, infection prevention is always top of mind in senior living. But this week, we're spotlighting something that might not be on every community's radar yet. The Association for Professionals in Infection Control, APIC, has put together a whole series of implementation guides.
Right, and these aren't just high level documents. They're practical step by step tools focused on preventing things like central line infections, urinary tract infections, C. diff, stuff we all know can be devastating for older adults.
Exactly. Each guide includes checklists, sample policies, and training templates. One I looked at even had a full staff competency module built in. So if you're updating your IPC protocols or onboarding new team members, this is gold.
And they're evidence based, right?
Right, research-backed and field-tested, and APIC updates them regularly, which is key. What worked in 2019 doesn't always hold up today.
You know, a lot of communities struggle with making infection control feel actionable, like they know what needs to happen, but not how to get there.
That's what makes these guides so useful. They bridge the gap between compliance and actual implementation. Whether you're in assisted living, memory care, or post-acute rehab, there's something in there you can apply today.
So, this could be a great agenda item for your next clinical leadership meeting. Pull one of these guides and walk through it as a team.
Exactly. It's not about adding more work, it's about making the work you're already doing more effective.
Speaking of infection control, there's also a new set of guidelines out from Argentum that's specifically tailored for assisted living communities.
Yeah, the QALC infection prevention and control guidelines, right?
That's the one. QALC stands for Quality and Assisted Living Collaborative, and this guide fills a big gap. It recognizes that assisted living isn't a hospital, but that residents still face real infection risks, and staff need clear, appropriate guidance.
So, not just a scaled down hospital manual.
Nope, it's built around the realities of assisted living. It covers environmental cleaning, staff training, surveillance, outbreak response, plus how to center resident autonomy while still managing risk.
I like that it balances safety and dignity. We don't want to turn these communities into clinical spaces, but we also can't ignore infection threats.
Exactly. This guide is a great tool for leadership teams who want to elevate their infection control practices without over medicalizing the environment.
It's also a great resource for staff education. You could build in service sessions right out of this.
For sure. And honestly, it's a smart move heading into respiratory virus season. The more prepared we are now, the fewer reactive decisions we'll have to make later.
All right, let's shift to something a little more high tech gait tracking. There's a new study out of Stanford that's getting attention because it might help us predict and prevent falls in older adults.
Right, this one's cool. They studied people walking under different conditions, like wearing ankle braces or having their vision partially blocked, and used that data to analyze gait patterns.
And the idea is that certain gait markers like step width variability or how predictable someone's foot placement is can signal when someone's at risk of losing balance.
Exactly. What's fascinating is they found these markers could predict fall risk with over 86% accuracy.
That's huge. I mean, falls are one of the leading causes of hospitalization in senior living.
And what's even better, they found that personalized baselines work better than comparing someone to general age norms. So you're tracking changes in that person's gait over time.
Which means this could totally integrate into wellness programming. Imagine capturing walking data during routine movement classes or rehab sessions.
Right. You don't need to wait until someone falls. You can see the trend and step in earlier with PT, strength training, or even just reevaluating their environment.
It's a great reminder that small changes in movement can be early red flags, and we don't always catch them until it's too late.
Exactly. Technology like this helps us see what residents might not be able to tell us yet.
All right, next up, we've got a study that's taking a very human approach to care transitions. This one's about helping residents and their care partners navigate the move from long-term care to the hospital.
Yeah, and this is such a tough moment for families. The study involved interviews with residents and families, and then co designed tools to make those transitions more informed and less overwhelming.
One of the tools was a decision aid flowchart, basically a visual guide to help residents and families talk through why a transfer might be needed and what their options are.
And they also added a hospitalization chapter to the LTC admission handbook, so people are prepared long before a crisis happens.
That's such a smart idea. I mean, no one wants to make big decisions under stress, and that's usually when these transfers happen.
Exactly. The third tool was a lanyard with a card and QR code, kind of like a portable profile that goes with the resident to the hospital.
So no more scrambling to find paperwork or contact info. It's all there.
Right. And the QR code links to detailed electronic information, things like preferences, medical history, emergency contacts.
It's a simple idea but powerful. It centers the resident in their own care, even when they're in a different setting.
And it gives hospital staff a better starting point. They're not walking in blind.
This is one of those things that could really be replicated in communities. Doesn't take a big budget, just intention.
Absolutely. If you haven't reviewed how your community handles hospital transitions lately, this is your sign.
Okay, let's talk policy for a second. There's a big change coming from CMS in 2026. It's part of the team model, and it affects how residents qualify for Medicare coverage of skilled nursing care.
Yeah, right now, most people know about the 3-day inpatient stay rule. You've got to be in the hospital for at least 3 consecutive midnights before Medicare will cover the SNF stay.
But under the team model, that's transforming episode accountability model, that rule is being waived for eligible residents.
So they can go from the hospital, or even an outpatient setting, directly to a skilled nursing facility and still have Medicare coverage?
Correct. As long as the hospital and the SNF are both participating in the model, and the episode of care qualifies.
That's a game changer. It could reduce unnecessary hospital days, streamline transitions, and cut down on delays in care.
Definitely. But it's not automatic. Communities will need to understand the billing codes, eligibility criteria, and make sure they're part of the team network if they want to use this model.
So this is one for your billing and admissions teams to start digging into. 2026 is around the corner, and aligning with partner hospitals takes time.
Yep, better to be proactive now than scrambling when it launches.
Next up, emergency preparedness. Argentum released a new white paper that updates best practices for senior living communities.
This one looks at everything from natural disasters to pandemics and emphasizes scalable plans, strong communication systems, and partnerships with local agencies.
One thing that stood out to me was the focus on resident-centered planning. Not just having a plan, but making sure it accounts for individual needs, mobility, medication, communication preferences.
Right. And there's a big section on backup systems, power, water, staffing, especially relevant with all the extreme weather events we've seen lately.
It's a good reminder that emergency planning isn't one and done. It needs to be reviewed, practiced, and updated regularly.
And it's not just about checklists, it's about confidence. Residents and staff need to feel like, if something happens, we've got this.
Exactly. If it's been more than a year since you tested your plan, now's the time.
All right, our last story this week is a quick but important one. It's from ASHRM, the American Society for Healthcare Risk Management. And it's all about the language we use.
Specifically, avoiding what they call never words. Words like never, always, or guarantee that can actually create liability risks.
Right, if you say, residents are never left alone, and then one resident is, well, now you've got a problem.
Exactly. The point is to be honest and clear in your policies and communication. Reassuring doesn't have to mean absolute.
It's also about training staff to communicate with families in a way that's confident but realistic.
This is especially important during move-ins or care plan meetings. We all want to make families feel supported, but it's better to set accurate expectations than to overpromise.
So maybe swap never for we strive to or our team is trained to. that kind of thing.
Exactly. It's a small shift, but one that could really protect your community and your reputation.
And that's a wrap on this week's HealthCap Weekly Wrap.
Thanks for tuning in and spending time with us today. You can find more details about all of these stories in the weekly roundup on Angie's blog at healthcapusa.com/Angie's blog.
We'll see you next time.